Next, we'll cover how you can manage tube feedings. Topics will include how to vent the feeding tube, flushing the tube, and what to do if the tube comes out.
Venting the tube provides relief for your child by letting excess air or fluids out of the stomach. Vent the tube when your child has a hard or swollen stomach, continuously cries or complains of pain, or vomits. There are two different ways to vent a feeding tube. Before you start, however, wash your hands. One method is to attach a catheter-tip syringe. Before you attach the syringe to the feeding port or to the extension set if your child has a low-profile device, pinch or clamp the tube to prevent any stomach contents from leaking out. Remove the plunger from the syringe and attach it to the feeding port or extension set. You can then let go of the tube or unclamp it. Now, hold the syringe above your child's stomach so the excess gas can escape. Based on the type of low-profile device your child has, a special decompression tube set with a one-way valve may be available. If you have that decompression set at home, attach the set to the tube port and open the valve to allow excess gas or stomach contents to flow out. Low-profile tubes without a decompression set can be vented with the extension feeding set as needed. If gas is present, you should hear or see the gas bubble come up through the tube and maybe see the stomach contents go up into the syringe or tubing. Positioning your child on one side, then the other, may help the venting process and bring some relief. It is important to return the fluid back into the stomach to ensure your child does not lose any nutrients. Remove the syringe or decompression tubing as soon as the gas contents are released. Then, clean the equipment the same way you clean tubing, by rinsing the extension set until clear. Remember, never use a decompression set as a feeding tube. Also, keep in mind that to help prevent additional gas or air in your child's stomach, run the formula to the end of the feeding set tubing before you attach it to your child's feeding tube.
Now we are ready to see how to flush your child's feeding tubes. To keep the tube clean on the inside, you need to flush with water several times a day, including before and after each feeding and whenever you give him or her medication.
Always begin with washing your hands. Then gather your supplies. You'll need a catheter-tipped syringe, a clean cup or bowl filled with lukewarm water. Don't use cold water, as that may cause stomach cramping. Extension tubing in place if your child has a button or low-profile tube. With the plunger in place, put the tip of the syringe into the cup of water. Now, gently pull the plunger back, drawing up the amount of water recommended by your doctor. Most extension sets have the clamp attached, so make sure the clamp is open. Place the tip of the syringe into the opening of the extension set. Gently press down on the plunger of the syringe to push the water through the tube. Do not force the water. If you have problems flushing the tube, contact your doctor or nurse. Finally, remove the syringe and extension set. Close the button.
This is the final program on management of your child's feeding tube. We will discuss what happens if the tube comes out. It is possible that your child may pull out the tube. It may also come out accidentally. Do not panic. Here are a few tips to remember.
If your child's NG tube comes out, try to reinsert it using the methods we have discussed earlier. If you have any problems or questions, contact your doctor. If a button or low-profile device comes out, follow the guidelines provided by your doctor. If you are unsure how to replace the button, Contact your doctor, who may advise you to come into his office or go to the nearest emergency department. Do not forget to take the displaced button with you.